We have supplements for our heart, supplements to support our liver, our kidneys, our colon, supplements to help with cognition, supplements to support our immune system, supplements to help our bones, our joints, supplements for our eyes, supplements for our skin health, even for our nails. Why is there no supplements for our tongue? The tongue is one of the busiest organs, always moving. Doesn't it need support once in a while? Today we are going to have a bit of fun learning what the tongue can tell us. The tongue can tell us a lot about what is going on inside. We just need to listen. That's the ear's job. And you know, there are supplements for ears too. Can I ask you, what's the first thing you do after you wake up from your sleep? If you are getting up in the morning and drinking water, pouring yourself a cup of java, or starting your breakfast, do you clean your mouth first? All the bacteria that was growing and living in your mouth overnight, you just swallowed it. The stomach acid should be able to handle it, but what if you're on a proton pump inhibitor, like Nexium, where there's less stomach acid to kill the unwanted bacteria? More on that in a moment. This episode is to get you thinking about oral health, oral care, and how does it affect your overall well-being, even brain health. Think about this. I ask, what's the first thing you do after waking up from your sleep? Do you check your tongue? Okay, so you do that. But what are you looking for? How does it look? Is there a coating or color on your tongue? Gray, bright red, yellow, white, even black? What about the texture? Swollen, wavy edges, cracked down the middle, dry. Sometimes color or texture shows up from something we ate, like blueberries, or you ate something spicy or hot. Really, it is to be aware of the changes going on with the surface of your tongue. Keep an eye on your tongue. The tongue can tell you a lot of what might be going on inside. The skin surface of the tongue, or papillae, changes every day. The papillae are the little bumps on the surface of the tongue. This is where your taste buds are housed. When those papillae are shedding, this means you have a healthy tongue. Now, this is only a guideline. Is your tongue gray, brown? Could mean intestinal issues, yellow, green, perhaps a liver or gallbladder concern. White, fungal, too much yeast going on. Consistently unusual thickness of a coating can mean there's something chronic or acute. What about the texture? Scalloped or wavy edges, swollen. These are not serious health conditions, but if there is pain associated with it, or if you continue to see this over a long period of time, could be something is brewing internally. A dry tongue, dehydration. Cracked tongue, down the middle, can be nutrient deficiencies. You may be familiar with the term geographical tongue. Let me go back to the papillae. The papillae needs to shed every day. This may not be happening with geographical tongue. The key is if there is pain associated with any of these guidelines I mentioned, then take note. But let's start here first. When you wake up, take a moment to clean your mouth, brush your teeth, and your tongue. Some people like to swish 1 teaspoon of coconut oil in their mouth, called oil pulling. Now you can look that one up. Then drink your water, then get on with your day. The mouth is the second largest population of bacteria in the body. Approximately 20 plus billion different species of bacteria live in your mouth. The bacteria in the mouth can migrate into the throat and ear canal, supporting oral, throat, and ear health. Upper respiratory infections are often caused by pathogenic bacteria through the mouth. which I think we all know from what we've experienced in the last couple of years with our social distancing. Stomach acid can kill bacteria within 15 minutes when your stomach pH is less than 3.0. Typically, when we wake up, our stomach pH tends to be low. A pH of 1.5 to 3.5 is considered normal for stomach acid, and it's a key defense mechanism against ingested pathogens. Getting back to the tongue, though, tongue symptoms like color and texture, for the most part, tongue disorders are due to a vitamin deficiency, maybe a medication, digestive problem, or dietary change. As I said, texture and color of the tongue can be caused by foods that are too spicy, salty, acidic, even too hot or too cold. But if you are monitoring your tongue every morning and not seeing an improvement, time to start investigating and let your ears start listening to your tongue. As I said, start with oral care. We all know to brush our teeth twice a day, floss, clean our mouth. What about the antiseptic or the fluoride in your toothpaste, which kills oral bacteria in the mouth? We need the bacteria, but use a natural toothpaste without fluoride. As I mentioned before, oil pulling, cleaning the mouth with water, swishing and spitting. When we kill off all the bacteria, it inhibits the production of nitric oxide. What is nitric oxide? Nitric oxide regulates blood flow and oxygen and can reduce inflammation. Nitric oxide is involved with different bodily functions like digestion, cognitive function, immunity, and cardiovascular health. Do you have high blood pressure, cholesterol concerns? Start with looking at your oral health. How can you replenish the oral bacteria? One bacteria is called Streptococcus salvarius, also referred to as Bliss K12. Hydration. This is a big one. When I tell people they should start their day drinking water or increase their water throughout the day, 96% of the time the reply is, I drink lots of water. Okay, but do you drink coffee or colas, eat spicy or salty food, sweat throughout the day? You have dehydrated yourself. Your small intestine needs that extra hydration. Water to help absorb the food. The timing of when you drink your water is so important. Here's a tip. Drink 2 or 3 glasses of water when you first get up. After you clean your mouth, don't drink and eat at the same time. This washes away the digestive enzymes to break down that meal. Drink 15 minutes before or 20 minutes after eating. If you really need to drink, sip water. Or you can add a tablespoon of apple cider vinegar to your water. This will help with digestion. B vitamin deficiencies. Where do we get our B vitamins from? Animal products and grains mostly. If you are a meat eater, think about the source of where you are getting that meat and what form it comes in. So is it red meat, salmon, chicken breast, or are you doing a lot of pre-made hamburgers, hot dogs, sausages, chicken fingers? You need to eat real food, not a processed meat. Grains, cereal, and bread products are all fortified with vitamins because the grain gets stripped of the nutrients as manufacturers have to add it back in. If you've been stressed the last few years, stress depletes the body of B vitamins. The gut microbiome produces hundreds of bioactive compounds, including B vitamins. B12 is made just at the end of the small intestine above the ileum valve, before the colon. Do you have digestive issues? Research shows Alzheimer patients are B12 deficient. Vitamin C. I think we get a lot of that nutrient over the summer months. But if you are eating more fresh and local produce, vitamin C can act as an anti-inflammatory antioxidant. And what does that mean? Basically, it can deal with the body's flare-ups of inflammation. Speaking of inflammation, we all have some form of inflammation throughout our body, from our tongue to our toes. You know those everyday aches and pain? That's inflammation talking. While inflammation is the body's natural healing response, chronic inflammation is a different story. Chronic inflammation wears us down, including our brains. Let's bring it back to food for a second. Did you know your empty stomach is about the size of your fist? After a big meal, it can stretch up to 12 inches long. That expansion causes stress on the stomach lining, potentially leading to something called leaky gut, a condition where proteins leak into the bloodstream and trigger an immune response, creating more inflammation throughout the body. Inflammation, poor digestion, and compromised gut health are all closely tied to brain health, foggy thinking, brain fog. We are all on our individual journey. Some of this will be relatable for you, some may not, and we'll swing back to how this shows up on your tongue. Diet, oral care, which I spoke about, medication, environment, stress. Summertime spices tend to be cooling spices such as mint, cilantro, coriander, cumin, saffron, which is good. However, when we struggle with digesting those barbecued meals, antacids to the rescue, proton pump inhibitors shut down excess stomach acid, may increase risk of infection. Proton pump inhibitors are only meant to be used for a short term. The research was done on a 2 to 12-week basis, yet individuals are on this for years. What about stress? Can that show up in your tongue? Environment, forest fires, air pollution are a stress on our system, especially if you have allergies or any sort of respiratory issues. Skincare products, mold, pesticides in farming, food additives, preservatives, another stressor. What about relationships, family, friends, work, and your own health? I'd like to challenge you for the next 7 days. Are you up to a challenge? Before I get into that, I want to bring your attention to what I've created in the last 5 years. Oral health is just one component to an overall well-being. These podcast episodes are designed to help you take stock of your habits and make actionable, meaningful changes that can improve your cognitive health. It can be as simple as cleaning your mouth first thing when you wake up. I have a lot more actionable steps I put together in this resource I call A Guide to Clear Thinking, 10 powerful factors to enhance brain health and helpful steps to prevent cognitive decline, where you can pick up your copy with the link in the show notes. Thank you for letting me share that. Here's your challenge for the next 7 days. I'd like you to start paying attention to what your tongue is telling you. First thing when you wake up and head to the washroom, look in the mirror and stick out your tongue. What do you see? I want you to pay attention to the color, coating, and texture of your tongue. Notice if there's any changes. Remember, the papillae should shed. If you're consistently seeing no changes to color, coating, or texture, take a moment to assess your diet, your lifestyle, your medications. Are you lacking a nutrient, not drinking enough water throughout the day? Only you can answer that. Be your own health advocate. As we are heading into summer months, what a great time to reassess your health goals and heal your digestion, improve your brain health, minimize your stress, improve your sleep patterns. Consume better quality nutrient-dense foods, make one change in your lifestyle and stick with it. Reduce or manage stress levels. Feel free to unplug for a day. Support your eliminating organs by removing toxins. Most importantly, stay well, enjoy the season, unplug, and breathe in all the goodness around you. You've been listening to Talk to Vicky, RHN, A Total Approach to Wellness. If this topic resonates with you, or you know someone who would benefit from the topic, feel free to share it. Go back and listen to those symptoms of your tongue again if you have to. Don't forget to download my free guide to taking steps to help with your lifestyle journey to wellness. All my social media and contact information is listed in the show notes below. Remember, listen to your tongue. It might have something important to say about your health. Do me a favor. If you are enjoying these videos, give me a like, a subscribe, leave a comment. I look at all the comments. Every time you interact with this channel, you are helping it to grow and reach more people with this message. Plus, I greatly appreciate it.